Hi, I am Michelle Woolley, a board member for Arlington Independent Media. We will be speaking with a candidate for the Democratic nomination for Arlington County Sheriff. Our panelists are Kim Phillip, co-founder and steering committee member of Arlington for Justice, board member of the Black Heritage Museum of Arlington, and former member of the county's Police Practices Work Group. Brad Haywood, Chief Public Defender for Arlington County and the City of Falls Church. Abby Raphael, former school board member at Arlington Public Schools. In this edition, the panelists will be speaking with James Herring.
Hi, James. Thank you for joining us today. What motivated you to run for sheriff?
So thank you for the question. So I worked in DC as a police officer before I came back home to Arlington County, and I'm a police officer here now. And it's no secret that there's a shortage of law enforcement across the country. Arlington's no different. And I just see how short-staffed we are. Simultaneously, I see a lot of the issues that are affecting public safety, affecting the community, are really kind of coming to a head. There's a lot of mental health issues that aren't being addressed. There's a lot of medical issues in the jail that aren't being addressed. And so I felt it was kind of time for me to throw my hat into the arena and see if I could, be the force for change, because I see a lot that's going on in Arlington County, especially that I think is just unacceptable for how wealthy this county is, how educated this county is. And I really want to change that because I think we can, kind of reset the manpower issues for law enforcement. We can change the health and safety for people who end up in custody. That in turn can actually holistically affect the recidivism rate in the region, because most of the people who are in the jail aren't from Arlington, they're from all over the region. And so I just see a lot of gaps that aren't being addressed, that aren't being talked about. And I figured it was time for somebody to stand up and talk about them, so why not me?
All right, thank you.
Nice to see you, James.
Good to see you, Brad.
You brought up the gaps in the system. You already mentioned one of them being mental health treatment. And a lot of people know that people with serious mental illness are overrepresented in the criminal legal system. Most people do not realize how bad it is in Arlington, and that it's exponentially worse, actually, literally exponentially worse than most other places. More than half of our jail takes mental health medication. We send more people to Western State Hospital for competency restoration than any other jurisdiction in the state, including Fairfax, which has 5 times the population and a higher crime rate. Just on Monday, as I'm the Chief Public Defender, we were appointed to 10 cases by the General District Court. On Tuesday, we moved for 5 of them to get competency evaluations. So it's kind of out of control. And this isn't all the sheriff's fault. I mean, it's not really the sheriff's fault at all. They're in the jail to begin with. But they're stuck with that problem. And my question for you is, first of all, why is this happening? Why are people with mental illness so overrepresented in our local justice system? And what's the sheriff's role in making this situation better?
So there's a lot to unpack there, and feel free to stop me if I'm on a time for each question. But I would say part of the issue is that we have spent as a society the most resources, the most capital, both political and financial, on the end state of the criminal justice system, the carceral services. It's just a lot more convenient for people to arrest someone and put them in a concrete cell and not have to think about them, whether it's a jail or a prison. We, as a society, have not really invested in these services that are kind of in the middle. If you have complete freedom on one end and you have imprisonment on the other end, there's a big gap in the middle. And we saw a lot of defunding with mental health services in the 80s, before my time, obviously, and they were supposed to transition to local services, state services. No one ever really picked up the slack. And we are still feeling the effects of decisions that were 40 years ago, 50 years ago today. So that's part of it. Another issue is why things are so egregious is that Arlington is a very wealthy county. It sits at the crossroads of 2 major interstate highways, a major airport, and a major metro rail system, and we're across the river from the nation's capital. And there is a lot of wealth disparity in the region as well. So there's a lot of those who have, and there's a lot of those who have not, and there's not a lot of cross-pollination of the two. And unfortunately, a lot of the community that has not ends up in the jail for all sorts of different reasons. We could talk about the wealth gap that started with slavery. We could talk about the lack of medical care that I think everybody has had issues with American medical care in society, and it's more pronounced when you are impoverished. That's also no secret. And so when people come to the jail, they are coming to a place where they are not well represented in society by, politicians or bureaucrats. They just don't have a voice. They oftentimes don't have access to the resources or even have any knowledge of the resources. I, as a Arlington County police officer, find out about new resources every day. So if I'm finding out about this stuff and it's my full-time job, I can only imagine how Byzantine it is to someone who's on the outside, probably not in the best mental health state, probably didn't get it, probably stopped their education at some point in their life due to economic issues or due to mental health issues, societal issues. And so the jail is kind of having, the catch-all, the receiver for all of that. And I will actually disagree with you in the sense I do think some of it is the sheriff's fault, because my platform is that the jail should be a point for a reset for people like, hey, we have you for a period of time. Let's take you, assess you medically, assess you through mental health services. Let's identify regional services through housing, through food assistance. Take all of that, regardless of whatever the criminal outcome of your case is, but you are in a known location for a known period of time. Let's take that and try to maximize that so we can get people connected to what they need to. So we're not just sending them out the door in the same state they were, just with another notch on their criminal record. I hope that answered it.
Yeah, great. Thank you.
Yeah, so to follow up on that, both in that answer and on your website, you have a pretty ambitious plan to connect people to jobs and substance abuse treatment and other services, which are all very much needed. But we know that the detention center has had staffing issues. The budget is what the budget is. So realistically, how can you deliver all those services with the resources that the jail has?
So the budget is what it is, but it also isn't what it is. I think everyone up here works in or has worked in government to some degree. So one of the most glaring issues with the sheriff's office is that they don't have a professional grant writer, and they haven't for some time. I don't know the reason behind that, but I can tell you the programs I'm talking about, and I just recently published on my social media about the HARP program, helping addicts recover progressively down in Chesterfield County, Virginia. That was started by the Sheriff Carl Leonard down there in 2016. It's now become a regional program, and it's doing everything that I'm talking about, and it has had success. It's been vetted by PhD accredited individuals who've looked at this program and said it is driving down the recidivism rate, one of the few probably in the country that is. And I think that in tandem with a professional grant writer, because again, will gleefully poach a good idea. They, in, I want to say 2020, through the CARES Act, got $1.2 million just to fund the HARP program. So if they can get 1.2 million, and then knowing that our sheriff's office routinely gets about 47 million from the county, that's about 2% of the budget. That's 2% that you can now reallocate either back into the county's coffers for other endeavors, or can be diffused throughout the sheriff's office to create more positions, whether they're in pretrial services, whether it's hiring more deputies, whether it's paying those deputies more, and having a sheriff that's willing to go to the county board and continuously lobby, because a lot of this is a conversation. And I think the county board, especially knowing all of the issues that are going on, they just need to be asked. They don't know what they don't know, and they're part-time. So you really have to be an advocate if you're a constitutional officer and say, here's what the problem is, here's why it's a problem, here's what I need from you, the people who control the purse, and hopefully you can help me. And I can't imagine in a county like Arlington, you'd fall on deaf ears for talking about medical care, mental health care for people in custody.
All right, thank you. So, are there any organizations like Offender Aid, Restoration, that you would be looking to for additional partnerships to enhance inmate services?
Yes, so another one is Arm in Arm. They have a peer support program that works with people that are addicts as well as dealers, because sometimes people can end up as dealers through societal pressures. There's many more, and not just in Arlington, but in DC. I want to work with pathways to housing. I think that's crucial because so many of the people that I've interacted with as a police officer are unhoused. And identifying not just like a specific place, because not an apartment that's good for someone isn't good for everyone. And so we need to find housing that is good for someone in their situation as it is right now. And we need to do that in the place they'd prefer to be home. Not everyone who ends up in the jail is from Arlington. And so if they are a DC resident, if they're a Maryland resident, if they are from elsewhere in Virginia, we need to work with other organizations potentially even outside the Beltway, so we can have a holistic answer, and we are getting stakeholders to come in and meet with someone face to face. And there's more organizations that I could name. I can't remember, did I say AFAC? That's another big one for food assistance. Getting people enrolled in SNAP as well. Most people, if they're aware of AFAC, they may not be aware of SNAP and connected to the state resources for that. Medicare, Medicaid, having a healthcare provider that gets people enrolled in that, because all too often when people leave custody, they don't have access to services anymore. And I think between the housing, between AFAC and SNAP, and between Medicare, Medicaid, all of those resources I think are going to be what can at least set someone up in the best position for them to make decisions to succeed, or at least have someone with them to help them succeed.
Thank you.
So I do a lot of criminal justice reform advocacy, and when people get first interested in criminal justice reform or prison reform, you often hear them talk about ending private prisons, and then the idea is that they don't like the idea that there's profit off of incarceration. What a lot of people don't realize until they spend a little more time in the field is that it isn't just companies running prisons that are the problem. Companies also profit off of providing services at jails, and they've done that in the past in Arlington with absurd phone call charges and charging outrageous amounts for canteen items like snacks. If you're elected sheriff, would you commit to free phone calls for detainees and also fair retail prices for canteen items?
I would. I don't see a reason against that. I mean, if I can get an unlimited data plan on my personal cell phone, I have to imagine that a multi-million-dollar law enforcement agency can find a contractor somewhere or a phone provider that is willing to provide, just a, line item expense for phone services to and from the jail. I don't think that that's going to be an impossible ask at all. And again, I think it'll be easier with a grant writer who can help underwrite some of these costs, maybe shift the costs to Richmond, shift the costs to DC if they have the money for us to pay for it. I think there's a lot of options out there, and the more money you have, the more options you have. So that's part of it. Commissary. I'm glad you brought that up, because one of the things I do mention on my site is I want to work more with local and regional farmers, try to bring food that is from our area into the jail rather than prepackaged items that have a lot of waste. Their shelf life, while it may be fantastic, it's not fantastic for you to eat. And if you put garbage in, the way that you feel combined with all the drugs that may be in your system and everything else, whereas if you put in a healthy, balanced diet that is from local farmers that would love to have some government money, as opposed to sending it to some contractor that probably doesn't make something you'd even want to feed your dog. I think that's very important. I know people are still going to want to buy Goldfish or Cheez-Its or what have you, so we will obviously provide those with at most a small upcharge just for the cost of getting them into the jail and stocked. But the idea is not to make a profit, just to make sure it's a net zero and people can have, as we'd say in the Army, their lickies and chewies to help have the creature comforts. But I also really do want to revamp the food provided systems in there, because I think working more with local and regional farmers and having people in custody work more with real food that was grown and is fresh will also enable them to make better decisions and also have better, healthier outcomes, which would be in keeping with having the medical care directly provided in the jail that I want to have.
So James, you are the only candidate who hasn't been a sheriff's deputy. What challenges do you think that would pose for you in running such a large and important department?
I think that there would be some challenges, just as when I was in the Army, there's challenges whenever you take over a new unit, especially if you're in the infantry. There's a lot of very dynamic personalities that have very strong thoughts about how things are supposed to be done. I think in the sheriff's office case, I'm actually benefited because I'm not coming in with a lot of inertia. I'm coming in with a clean slate, and I'm coming in with an outsider's perspective, which I think is needed because there have been 8 in-custody deaths in the past 10 years, one of which Richmond, an agency from Richmond even said that Arlington County Sheriff's Office was negligent in providing care for that individual, and we paid out $1.3 million to the family, as we should. If you're negligent in someone's death, I don't think that was unreasonable, but I think for the care and for the way that the sheriff's office is being run and kind of the glaring issues that I spoke about initially, I think it is time to have change. And I don't view my lack of time in the sheriff's office as a hindrance. I view it as a positive, because I think too often we see people work in the same organization and they develop blind spots. Things get done the way they are because it's the way it's always been done. And I don't accept that. I don't accept that in a county that is as well-heeled, well-resourced as our county is. I know enough to know what I don't know, and surrounding myself with experts and having a team approach I think is absolutely crucial. Reaching out to whoever the Commonwealth Attorney is, reaching out to whomever the public defender is, reaching out to the judges, talking to other sheriffs throughout the area, and the Sheriff's Association puts on an annual class for newly elected sheriffs, because it's not it's not something that is impossible to happen, that someone has not been a sheriff before. It's happened before in Virginia. It's going to happen again. People who've never worked in a sheriff's office. And actually, the gentleman, Carl Leonard, who started HARP, he was a police officer, a police captain, had never worked in the sheriff's office, and he has created HARP. He's lowered recidivism in Chesterfield. His program's been featured on Discovery Plus. So knowing that someone from an outsider's perspective can come in and have that level of success, I think is an easy path for me to follow. And I look forward to the challenge.
Great. So is staffing for court security sufficient? And what improvements would you make in court security given the staffing that exists?
So staffing for court security, I don't think staffing in general is sufficient for any law enforcement agency. But if we're going to get down to the court level, I would say, we have 2 entrances, but it's very rare that both of them are open for you to go through a security checkpoint. I think one of the things we saw with COVID is a lot of things became digitized. We found all of a sudden these things that were impossible to do were very possible to do through electronic means and just having a little bit of outreach. And something I would like to see more, working with the judges and working on the traffic docket, which brings a large volume into the courthouse of people who probably don't realistically need to be there for most of those cases. Because again, I'll get really granular for a second here. There's a ticket in Virginia called a compliance ticket. So if you get a headlight out or a tail light out, you get pulled over for that and some other offense, you get the ticket, but if you get it fixed, you can get the ticket dismissed. I think it's silly to have an assigned date for someone to come in just to say, hey judge, here's a receipt, officer, are you satisfied with that? I think if someone, because then also I might have a court date that's several weeks or even a few months out, and I'm driving without the headlight, and I all of a sudden get the reminder, oh, I should go fix that. I think if you incentivize people to, hey, you can come in before your court date, or you could even, if you meet the officer and they're satisfied, get that dismissed. Now all of a sudden you're seeing the court docket go down, and you're seeing the number of people who needlessly need to come into the jail, or not the jail, come into the courthouse go down. Things like that, working with some of the other agencies that are in the courthouse, the CA's office, working with the defender's office, working with the clerk of the circuit court to figure out what are things we can do to reduce the personnel footprint coming in. I think those are all things that we can do to knowing that we're not going to get more people in the immediacy. And, as far as trying to get more manpower into the courts and into the jails. We have to look through technological means and try to be innovative, try to find systems that we can automate a little bit more, try to find ways that we can reduce the manpower footprint without sacrificing safety. Getting some of the late 90s systems maybe a little bit more modernized for the 21st century, get a more robust camera system, have the control systems in the jail and in the courthouse as well modernized. I think those are all things that, while they would take time, would yield results that would free up more deputies. And I will say too, Arlington has a proclivity for being very top-heavy across all sectors. So something that, again, can free up more manpower would just simply being understanding that maybe we don't need a boss for every 2 people. Maybe we can pull that number back a little bit, just pay deputies more to encourage them to stay and fix numbers that way. So those are all ideas that I have.
You've already mentioned a couple times you're interested in having an in-house medical unit. So I'm going to ask this question a little differently. So long ago, before Daryl Beckton died, the Arlington Detention Center was working with Corizon, which was an abominable jail medical provider. After he died, there was an outcry and a call for a change. I remember at that time there was a discussion about an in-house medical unit, and it was emphasized to the county board and also to Sheriff Arthur that's really important. And the county board didn't really understand the scope of the problem. They ended up going with another jail medical provider. And I remember that time talking with Sheriff Arthur and telling her there is no good jail medical provider. They don't understand the scope of this problem either. You're just going to find yourself in the same position. Even during that transition period, I remember a point in time where there were 2 or 3 weeks where they had no psychiatrist coming into the building. We had a client, and we were told kind of on the down low by one of the jail mental health staff that he was just bashing his head against a concrete wall, and no one was doing anything about it. And you mentioned you think that any county board member would be, we would be gladly willing to fund these things or that things. I kind of disagree with that, and I think there needs to be more advocacy. And I guess in terms of highlighting the severity of the problem and what needs to be done, and I guess my question for you is, how would you go about making this happen? Because I think there are going to be obstacles, funding obstacles in particular, and convincing people, politicians, community members, of the need to spend the amount of money to get the right kind of jail medical services so these tragedies don't happen again. So how do you think you would accomplish that?
So that's a great question. Again, a bit to unpack. So my first priority would be to uncoil us from the contract that is, I think right now we're on Medico is the name of the company that we currently have. And I want to have a medical doctor who works as the medical director in the jail. And once we can get the situation stabilized just on the emergency medicine front, really have them transition to basically a primary care physician for all people who enter the jail. I want them to also build out a program. They'd have carte blanche to hire nurse practitioners, physician's assistants, and then also be expected to get deputies trained up to EMT and paramedic level medicine, because if one of us had an emergency right now, we would call the fire department, we'd get into an ambulance, we'd be taken to the ER, and we'd be there in about 10 minutes. And we'd be receiving professional medical care every step of the way. In the jail, they have to lock down the entire jail. And as last count I think I heard is about 300 people in custody. Some of those individuals are less keen to do what they're told at a moment's notice. So trying to get 300 people to do the same thing expeditiously because someone's having a medical emergency that could lead to death, that is time that you're losing that could lead to brain function loss or to death, and that's time they're not getting proper medical care. So I think what I'm talking about will address the emergency level, and we know that people will get to the ER and they will, if they have a chance, they will continue to have a chance all the way to getting to the ER, not lose time due to a lack of training, a lack of resources. So that's kind of to unpack part of that. As far as the fundraising and the walls that I think I could potentially run into as an elected official, I mean, even very popular programs can run into walls. Social Security was not the most popular when they were trying to implement it. Medicare and Medicaid were not the most popular when they were trying to implement it. And now these programs, no one can envision life without them. But it took someone to strongly advocate and just keep hammering. And as someone who, coming from a police officer's perspective, I had experience in Southeast DC, I have experience here in Arlington, coming from the Army Infantry, but then also being an Arlingtonian, I think I can strike the right temperature to be politely insistent and I think also, even if maybe other elected officials wouldn't agree, I think using the bully pulpit that the singular elected official from public safety would have, the sheriff, I think using that and advocating politely, not trying to burn bridges, but saying this is a problem. We have very robust local media with Arlington Now, Washington Post, Gazette Leader. I think hammering all of those and educating the public, we would see barriers come down very quickly, because again, we're not talking about things that are we're not talking about widening roads or putting in bike lanes. We're talking literally about people's lives, and I think that will get people roiled up very quickly, especially with everything that has occurred in law enforcement in the past 10 years. Law enforcement is understandably under a microscope. It should be. It should always be. We provide a public service, but we have a huge amount of public trust. But we should use that trust to be advocates and educators as to what we can do to further the situation, try to help people that don't typically get help and be the change that we want to see.
So following up on that, getting people the help that they need. So the detention center has lots of partnerships with different organizations to provide services to detainees. Job training is one that it seems that there could be a lot more, where we could have programs in the jail where detainees could be paid a reasonable wage, and then get the skills that they need and actually be very marketable for getting jobs and even connect them to jobs, which is something you've talked about. So what specifically do you have in mind with that? And again, the practical part of that, how do you pay for it?
So as far as paying for it, that's where I would try to go to the community and say, I see a lot of places out here with help wanted signs. What can I do to get you to interact with some people in custody? Or maybe we can reinstitute a work program and have people who are trusted go out into the community and work that job with a bit of oversight from a deputy, but start working that job, while they're still in custody. So that way they're getting the vocational training, whether it's learning to become a chef, whether it's learning how to do carpentry, whether it's electrical. There's a huge demand for people in trades. But that also needs to be a conversation with the person in custody too. We can't just force a job on someone, because some of these are highly technical, and if they have no interest in doing that, we're wasting everyone's time. So bringing in community leaders, bringing in those organizations, but also thinking, going beyond, talking to, Amazon has shown that they're willing to work in the community with high school programs. I would love to lobby them and see what can we do to get maybe some people who are in custody who are, we have some people that end up in the jail because of electronic crimes, fraud and such. Take that brain power and put it to something constructive, build better systems, build better human resources systems and such. So we are only hamstrung by our lack of imagination and our lack of going to the community. And I have, from knocking on doors and from talking to people, and I just came from a civic association meeting in Aurora Highlands where people were asking the police department, what can we do to be better? What can we do to better help you? We have a community full of people that want to help. We just need, someone acting as the quarterback to say, you can help this way, you can help that way. And again, I think an elected sheriff is perfectly situated for that, to be the getting people connected to who they need to be connected to.
Thank you very much, James.
Thank you.